Hello, my name is Vicky Kiesel. I'm a registered genetic counsellor and I'm here to answer some of the common questions about genetic testing. Prostate gene. What do we test for? Prostate gene is a genetic test which analyses the DNA code for 8 different genes. These genes have been shown to cause an increased risk of prostate and associated cancers. Genes for Lynch syndrome and BRCA1 and 2 are included in this test. What are genes? Genes are the body's instructions and determine how the body develops and is maintained. Some genes prevent cancer developing, so if there is a mutation in one of these cancer genes, then the gene doesn't work correctly and will cause an increased risk of cancer. Why would I want genetic testing? Genetic testing can help to determine your risk of prostate and associated cancers. If you do have an increased risk, then you may benefit from prostate screening, usually with PSA and possibly other biomarkers. Screening for associated cancers may also be beneficial. Why is genetic counselling important? Genetic counselling assesses a client's family history and provides a risk assessment. The genetic counsellor will also explain exactly what the test includes and the implications of testing. How does the test work and how long do the results take? The test is performed on a blood sample and the results will be available approximately 8 weeks after you have your blood taken. An appointment will be made with the genetic counsellor who will explain the results and recommend appropriate cancer screening. The test uses state-of-the-art technology known as new generation sequencing to examine the code for each of the 8 genes in detail. In addition, further analysis is used to look for large missing or extra parts of selected genes. Who should be tested? People at risk of hereditary prostate cancer may wish to consider genetic testing, and where possible, it is always more accurate to test someone who has had prostate cancer. The majority of prostate cancer occurs by chance. However, approximately 5 to 9% of prostate cancer is estimated to be hereditary, and 25% is familial. Families with hereditary prostate cancer generally have several relatives with prostate or associated cancers, often diagnosed at younger ages. A genetic counsellor can assess your family history and tell you what your personal risk is. What does this mean for my family members? If a genetic mutation is found in the family, it is possible to offer genetic testing to other relatives to help determine their risk of cancer and recommend appropriate screening. When someone has a gene mutation, there is a 50% chance that they will pass it on to their children. Is screening for prostate cancer effective? Prostate screening aims to diagnose prostate cancers at an earlier, more treatable stage. However, prostate screening is still imprecise and in some situations may lead to unnecessary biopsies or false reassurance. 2/3 of men with a raised PSA test result will not have cancer. Recent research has shown that other biomarkers can improve the accuracy of the PSA test, and this method of screening is offered by Prostate Health UK. What can I do to lower my risk of prostate cancer? A diet high in green vegetables, lycopenes from tomatoes, and low in red meat may lower the risk of prostate cancer. How do I book an appointment to discuss the test, and do I need a GP referral? Please call 0800 085 6696 to book an appointment with a genetic counsellor to discuss the test. You do not usually require a GP referral. Initially, you will be sent a family history questionnaire which will be analysed, and then an appointment will be scheduled for you with the genetic counsellor at a mutually convenient time and date.